Precision verbs for PCCPs and ACPs, FDA submission language. Welcome! In this micro lesson, we'll make your FDA documentation sharper. A PCCP is your high-level plan that outlines how you'll manage future device changes without new submissions each time. An ACPC-specific, actionable protocol inside the PCCP describing exactly how one change will be executed and controlled. The FDA scrutinizes your wording to ensure clarity, boundaries, and patient safety. Choosing precise verbs limits interpretation, reduces risk, and speeds review. Think of it as writing a contract with future you: clear triggers, defined actions, measurable outcomes. Nothing fuzzy, everything testable. Good triggers start with objective verbs like detect, exceed, or meet. These signal that a condition is measurable and real. Avoid vague verbs like notice, feel, or seem. They invite debate and delay. Always tie triggers to data and thresholds, numbers, counts, or statistical limits. Make the source explicit so auditors know where the signal comes from. System logs, automated alarms, or quality control tests. If two people could read your trigger and reach different conclusions, rewrite it until the start condition is observable, repeatable, and verifiable. Use concrete, thresholded statements. Detects drift greater than X% in calibration set. Pinpoints model stability issues with a numeric drift boundary. Exceeds alert limit in 3 consecutive runs, requires persistence, reducing noise from one-off spikes. Fails daily self-test twice within 24 hours, balances sensitivity and false alarms using frequency and time. Meets data sufficiency. N is greater than or equal to 1,000 cases, clarifies when there's enough evidence to proceed. Each phrase names a metric, a threshold, and often a window, creating a trigger you can audit and defend. Once a trigger fires, use operational verbs that commit to work. Update, retrain, deploy. Add safeguards like validate, verify, and roll back to manage risk. Avoid soft modal hedging, phrases like may, might, or consider weaken accountability. Bound the action with who/what/when, the team responsible, the artifacts to change, and the timeline or window. For example, MLOps retrain model, validate on pre-specified set, and deploy within 5 business days. Clear actions make testing, auditing, and FDA review straightforward. Aim for actions that are testable and safe. Retrain model with locked feature set controls scope and prevents unapproved variable creep. Validate AUC is greater than or equal to 0.90 on pre-specified set, sets a performance floor and fixes the dataset in advance. Deploy via phased rollout 2 is less than or equal to 10% first, limits exposure and enables monitoring under real use. Roll back if post-market metric drops greater than Y%, defines a safety valve with a clear threshold. Each phrase includes a verb, a constraint, and a metric, which together create a verifiable commitment. Map each trigger to one or more actions so readers can follow the chain. Use simple logic connectors, then, after, if not to show sequences and contingencies. Example: detects drift greater than X% right pointing arrow retrain. If not recovered, roll back. Reference artifacts like protocol IDs and versions to anchor the process per ACP 03 version 1.2. Maintain end-to-end traceability. Requirements: right pointing arrow design, right pointing arrow validation, right pointing arrow verification, right pointing arrow release notes, right pointing arrow post-market monitoring. When everything is linked, you can prove that each decision was planned, executed, and checked. Choose modals deliberately. Use shall/must for required steps. Validation must achieve AUC is greater than or equal to 0.90. Use may only for permitted options. Team may retrain with prior weights. Quantify limits so scope stays tight. Time windows, data volume, user percentages, or site counts. Define the change class, minor versus moderate, to align with your PCCP categories and reporting expectations. This disciplined language creates enforceable commitments, reduces ambiguity, and signals to reviewers that your process is controlled and risk-aware. Before submission, check these boxes. Triggers are measurable, source-stated, and thresholded. Actions are testable, safe, reversible, and clearly owned. Prefer concrete verbs over impressions. Commit with detect, validate, deploy, roll back. The payoff: a clearer PCCP, defensible ACPs, and a smoother FDA review. Tight language isn't bureaucracy. It's how you scale safe, rapid iteration without resubmitting every change. Write like an engineer and an auditor will both say yes.